Well, I'd come back to it. Mr. McLean, you're right, and I really appreciate some of the ideas that are coming out of this. And this idea that is being brought up of how do we get the big idea? How do we get to the big idea? I guess one of my concerns is, and I would ask on a comparison, this is to you, Dr. McCoy, you carried around this. This is the collective bargaining agreement between St. Mary's Hospital, the Mayo Clinic, and their health care providers. It doesn't make as good a theater as a big one, but it's still there. I would make the argument that the Mayo Clinic delivers good quality health care. Your assertion is that it's totally based on the collective bargaining of the people there. I don't believe in any way moves this argument forward. So my question to you is, when was the last time you personally were in a VA hospital? And tell me about your experience there as you talk to the providers and talk to those nurses at the nursing station.
Well, I actually just talked to some of the people at the VA hospital here in D.C. a few minutes ago, and let me explain that they are, right, I haven't been to their hospital yet, but I have talked to them, and let me explain that they are also concerned about the mismanagement or misallocation of staff resources. It's so bad, for example, that at some of the VAs, and I know you'll probably confirm this, the physician has to spend a lot of time going out to the waiting room, getting the patient, explaining how to disrobe, doing a lot of things that in another hospital or clinic would be done by ancillary staff so that doctors can see not 2 patients an hour or 3, but maybe 6. Some of this is a problem with union rules, and to say that it isn't is just preposterous. I haven't read their agreement, but to say that unions are not part of this problem is just read the American Federation of Government. Just let me finish. You asked me to come here.
You answer.
Now, that is not true. In a democracy, we both get to talk.
Mr. Chairman, I'll yield back my time.
Time has expired.
Thank you. I would like to explain,
Dr. Rowe, I apologize. We're very short on time. So, Dr. Rowe.
Thank you, Mr. Chairman. Mr. McLean, I think you're 100% correct when the VA needs to go through a top-down look from an outside agency. It doesn't need to be evaluated within anymore. It needs to have an outside look. And what Mr. Michaud said is absolutely correct. The VA could do one thing today. I said this Monday night at the hearing. That the years I spent in clinical practice in medicine, I knew who I worked for, and that was the patient. That was the center of why I was there. If I didn't have patients to see, I had no reason to be in an office. And if you ask anybody on a VA campus who they work for, they'll say the VA. The answer should be we work for veterans. That should be the answer. And that's a simple change in philosophy that changes. I don't have any reason to be at this VA if they're not veterans there for me to care for. So I think you could do that one thing. And I think the top-down approach, I think you're spot on. And I think several things were brought up. Just interestingly, Mr. McLean, you mentioned at a CBOC that you ran that the VA had 4 to 5 personnel to help, ancillary people to help. In our office,